The UNFPA gender-based violence expert, Mrs. Letio Evelyn, highlighted the importance of the document by saying it will ensure that victims get help in a coordinated manner.
Put together the different roles that we play as stakeholders for GBV and to streamline how we relate with one another so that we are able to provide services in a coordinated way, in an effective way, and that we are able to ensure that survivors get the broad range of GBV services that they are required. So usually when survivors experience violence, they have health needs, they have legal needs, they have security needs, and they have psychosocial needs. And these players have to work together with one another to provide this range of services. So we have collaboratively developed a standard operating procedure that streamlines what we do as different stakeholders and how we share information amongst ourselves to be able to ensure the survivor gets the whole range of comprehensive.
She stressed that this has been triggered by the recent El Nino event and was funded by DFID, so the loopholes they saw are now being dealt with. Mrs. Evelyn highlighted some of the successes they achieved while dealing with GBV issues.
We have been able to train health workers on providing clinical management of rape. We have worked with Ministry of Health to develop guidelines on how to respond to survivors. We have been able to work with different districts to be able to train people on what we call the survivor-centered approach so that they are able to provide services that are ethical and that are safe for survivors. And we have established a coordination body where we are together putting in critical documents like a referral pathway that stipulates where a survivor should go when they experience violence, why a survivor should go to those particular places, and within what time frame those survivors should be able to go. We also have been able to develop these SOPs that streamlines how that referral.
She added that the inception of Lesotho for men and community leaders sensitized men on how to better treat women with care. One of the participants from She Hive, an organization dealing with the victims of gender-based violence in families, Mrs. Mantala Ramahula, said they are now at the apex of their work, whereby they are reviewing how far they are, saying it opened their eyes on a number of areas.
ya hore ka nako tse dingwe o tla fumana hore ha re batle hore re bue ka ditaba tsa tlhekefetso hobaneng re nahana hore di tlotla di kena le ditaba tsa malapa jwalo, empa ha re ntse re shebana le tokomane tsena tse ntseng re sebetsa hona jwale e re tataisa hore na ebe re ka qhibolla dintho tse re reng ke marakwaneng a beile hore re ka iphumana re se re tswetse pele hore re fumane thuso jwang. Gore ha re fumana hore batho ba rona ba tla be batla ho rona hangata o tla fumana hore moo ba tswang teng ba ne ba sa tsebe hore na ebe ba ne ba tshwanetse hore ba etseng kapa ebe ba ne ba fumane boeletsi mohlomong bo reng taba ena mohlomong re ke etse mohlalo ha ngwana e ka ba wa betwa kapa o etsuwang ebe jole ho tla ho thuta bena e ka sebetsiwa ka hare ho lelapa re bulwa mahlo hona tjena hore re ka eletsa batho bano hore ba tle ba bona hore ha le sebetsa ka hare ho lelapa fela le sa ipele mo kana nngwe ka nna ba lentse le tlhola le molao le no ba nne o so entse tlhekefetso.
Mrs. Ramahula also said they now know places where to direct victims, especially in remote areas where less services are available. The document is expected to be finalized by the end of next month and launched. Institutions which participated in this event include the police, Ministry of Gender, She Hive, FIDA and Justice Inter Alia. Rapito, LTV News, Maseru.